Hello, everyone. My name is Shadi Reis from Detroit Medical Center. ACC 2022 just finished, and it was rich with interventional cardiology trial that's related to the interventional cardiologist practice. With me is Dr. Gary Ledley. He is the Regional Director of Cardiology of Tower Health System and Professor of Medicine at Drexel University, Philadelphia, Pennsylvania. Dr. Ledley will walk us through the complete trial that was presented as a late breaker at the ACC 2020.
Thank you very much, Shadi, and thanks for inviting me to be here this evening. What I'd like to do is talk about a topic that I'm very excited about, which is the quality of life effects of coronary angioplasty. And this is a sub-study of the complete trial, Quality of Life. As you may know, the complete trial was published in 2019 in the New England Journal of Medicine, and it was a very exciting trial as well. This trial studied the difference in outcomes, hard outcomes, death and MI, on complete revascularization strategy for patients coming with STEMI and multivessel coronary artery disease versus a culprit-only strategy in patients coming with a STEMI and having coronary artery disease, multivessel coronary artery disease. And that study was very positive for the complete revascularization. So in that study, 4,000 patients were randomized. It was prospective and randomized. And 2,000 patients had the complete revascularization strategy, and about 2,000 patients had the partial revascularization strategy. And the endpoints were a composite of death and MI. The complete revascular strategy was better than the culprit only. And in addition, there was the composite endpoint of death, MI, and ischemia-driven revascularization. And again, that composite endpoint was better in the complete revascularization strategy than culprit only. But a very important sub-study of that trial that was planned right at the beginning looked at quality of life, because patients aren't only interested in death, MI, and another angioplasty. They want to know, doc, am I going to feel better when all this is done, or which strategy will help me feel better in my activities of daily living and working and things that I want to do. So that's why I'm so excited about this trial. For this study, the question is, did complete revascularization improve angina-related quality of life compared to the culprit lesion-only angioplasty in patients with STEMI and multivessel coronary artery disease? The quantitative quality of life was determined by the Seattle Angina Questionnaire, and the results at 3 years were very striking. So each of the 5 subsets of quality of life favored complete revascularization strategy versus the culprit-only strategy. And that included angina frequency with a p-value of 0.006, physical limitation strategy with a p-value of 0.018, treatment satisfaction with the p-value of 0.028, quality of life score of 0.048, and an overall summary score with the p-value of 0.003. So that's quite a striking benefit in quality of life for the complete revascularization versus the culprit only. And that led, in addition to the guidelines being changed from the complete trial, suggesting a complete revascularization in the ACC AHA guidelines, this now adds to that. And I think its clinical relevance is that when we're talking to patients about the strategy that we're going to use, this is something that we can discuss with them for shared decision-making.
Dr. Ledley, wonderfully done summarizing the complete trial. As you mentioned, it is pushing the envelope to understand more how to treat this cohort of patients presenting with STEMI and multivessel coronary artery disease. Please watch this video and others on the SCAI-TV. I am Shadi Reis, and this is Dr. Gary Ledley from the SCAI Communication Committee. Thank you for watching. Dr. Ledley, thank you so much.